shoulder pain and frozen shoulder, the truth, the hope, and the new science of healing. My dear friends, shoulder pain is not a small problem. It is one of the most disabling, frustrating, and life-limiting conditions affecting millions of people around the world. When your shoulder freezes, your entire life freezes. You cannot lift your arm. You cannot comb your hair. You cannot wear clothes comfortably. You cannot sleep. You cannot drive. You cannot hug your children. You cannot lift even a glass without pain. It affects your work. It affects your sleep. It affects your confidence. It affects your peace. And yet, many people have no idea what is happening inside their shoulder. Many believe it's just age. It will get better on its own. Nothing can be done. But that is not true. Frozen shoulder is a condition with a clear cause, a clear path, and, most importantly, a clear path to recovery. And with today's advanced therapy options like EMTT, TCAR, terahertz, infrared, along with correct exercises, the suffering can be shortened dramatically. Let us understand this deeply. 2. What is frozen shoulder? Frozen shoulder, adhesive capsulitis, is a condition where the shoulder capsule becomes inflamed, the joint space becomes tight, adhesions form, the shoulder becomes stiff, movement becomes painful, the range of motion reduces drastically. There are 3 phases: freezing, painful phase, severe pain, movement becomes limited, frozen, stiff phase. Pain reduces, stiffness becomes maximum. Thawing, recovery phase, movement gradually returns. 3. Epidemiology affects 2 to 5% of the population. More common in women. Peak age, 40 to 60 years. More common in diabetics, 10–30%. More common in thyroid disorders. Often bilateral, affects both shoulders over time. Increasing rapidly due to sedentary lifestyle. 4. Causes and risk factors, diabetes. One of the strongest risk factors. Thyroid disorders, triggers inflammation. Long-term immobility, after injury, surgery, or fracture. Overuse with poor biomechanics, repetitive overhead activities. Hormonal changes, especially in women. Emotional stress, tight muscles, bad posture, shoulder dysfunction. Poor posture. Rounded shoulders, forward head position. Weak rotator cuff muscles. Leads to faulty movement patterns. Microinflammation caused by poor diet, metabolic syndrome, chronic stress. Frozen shoulder is essentially a problem of inflammation plus tightness plus reduced joint capsule mobility. 5. Pathology. What happens inside? Inside the shoulder joint. Inflammation develops. Capsule becomes thick and tight. Adhesions form. Joint space narrows. Synovial fluid decreases. Muscles around the joint go into spasm. Pain becomes severe. Range of motion becomes extremely restricted. Frozen shoulder is not muscular pain. It is a joint capsule contracture. 6. How long does frozen shoulder take without treatment? Without treatment, it can take 1 to 3 years to resolve. Yes, up to 36 months. Some people never regain full movement. This is why early intervention is critically important. 7. Current standard treatment. NSAIDs, pain relief. Steroid injections, temporary relief. Physiotherapy, hot-cold packs, manual stretching, hydrodilation, suprascapular nerve block, surgery, rare cases, manipulation under anesthesia. But many people do not respond well to standard treatment alone because the underlying pathology is capsular stiffness plus inflammation plus tight fascia plus muscle guarding plus poor circulation. This is why energy therapies have such dramatic results. 8. Relationship with diet and lifestyle. Excess sugar worsens inflammation. Vitamin D deficiency weakens muscles, increases pain, stress, tightens neck and shoulder muscles. Sedentary lifestyle weakens rotator cuff and scapular stabilizers. Metabolic inflammation causes stiffness in joint capsule. Diet should include anti-inflammatory foods, turmeric, ginger, berries, nuts, fatty fish, olive oil, greens, avoid, sugar, white flour, processed foods. 9. Role of exercises. Exercises are absolutely essential. Pendulum swings, wall climbing, cross-body stretch. External rotation with stick, internal rotation, towel stretch. Scapular strengthening posture correction. But exercises alone cannot reduce inflammation fast enough. This is where energy medicine plays a powerful role. 10. A new era, energy medicine for frozen shoulder. Energy medicine supports recovery by reducing inflammation, improving microcirculation, relaxing deep muscles, increasing ATP production, breaking capsular stiffness, improving nerve communication, reducing pain instantly, restoring mobility faster. Let us see the most powerful technologies. 11. EMTT, a breakthrough in frozen shoulder treatment. EMTT, extracorporeal magnetotransduction therapy, is one of the fastest-acting therapies for frozen shoulder. It delivers high-energy magnetic pulses deep into the capsule and muscles. Benefits of EMTT. Rapid pain relief, sometimes in one session. Many patients feel better after 15 to 20 minutes. Deep tissue penetration, 15 to 18 centimeters. Reaches joint capsule, rotator cuff, deep fascia. Reduces capsular inflammation, targeting the root cause. Relaxes spasmed muscles, improves movement instantly, improves microcirculation and synovial fluid flow, helps joint glide better, enhances cellular repair, ATP increase, supports healing, improves range of motion, sometimes significantly in the first few sessions. This therapy often helps patients who couldn't lift their arm, couldn't sleep, couldn't reach their back, had pain for months, didn't respond to exercises. EMTT accelerates the thawing phase naturally. 12th, TCAR therapy, deep healing. Through capacitive and resistive energy transfer. TCAR works by transmitting high-frequency energy deep into tissues, producing deep warmth, increased blood flow, rapid pain relief, soft tissue relaxation, capsular softening. TCAR is especially useful in the painful phase of frozen shoulder. Reduces swelling, improves synovial fluid movement, softens the tightened capsule, enhances stretch tolerance. 13th, terahertz therapy, frequency-based tissue activation. Terahertz waves improve hydration, reduce microinflammation, improve fascia gliding, increase cellular vibration and energy, relax stiff tissues, support shoulder mobility. Helpful in both frozen and thawing phases. 14. Infrared light. Therapy. Infrared penetrates deeply and reduces inflammation, decreases stiffness, improves circulation, accelerates repair, relaxes muscles. Infrared plus EMTT is a powerful combination. 15th. Additional helpful supplements. Vitamin D3, magnesium, collagen, curcumin, omega-3, MSM, boswellia. 16th, the mind-shoulder connection. Why stress makes it worse. Many patients are surprised when I tell them stress is one of the hidden amplifiers of frozen shoulder. When stressed, the neck tightens, trapezius tightens, shoulders elevate, blood flow reduces, inflammation increases, pain, sensitivity increases, sleep reduces, affecting repair. This creates a vicious cycle. Stress, muscle tension, poor posture, capsule strain, more inflammation, more pain. This is why therapies that calm the nervous system, like neuroregulation, humming, breathwork, meditation, VNS stimulation, PEMF, Vilite, dramatically improve results. 17. Why early treatment makes a massive difference. Many people wait for months thinking, it will improve on its own. I don't want medicines. Let me try home remedies first. But frozen shoulder is like cement. The longer it sits unattended, the harder it becomes. Early treatment prevents capsule fibrosis, severe adhesions, long recovery periods, unnecessary injections, chronic pain, sleep loss, severe stiffness. Intervening early with EMTT, TCAR, infrared, and correct exercises can reduce suffering from 1 to 3 years to a few weeks or months. 18. Practical daily routine for frozen shoulder recovery. Here is a simple yet powerful regimen for your viewers' patience. Morning, 10 to 15 minutes, hot pack, 5 minutes, pendulum swings, wall climbing, external rotation with stick posture alignment check. Afternoon, evening, gentle stretching, terahertz hydration therapy, if available. Scapular activation, light walking, improves circulation. Night routine, infrared therapy. Humming or deep breathing reduces pain, signals. Sleep before 11 p.m. 2 to 3 times a week, EMTT TCAR laser/infrared deep fascial release, assisted. NCHs. Daily supplements, vitamin D3, omega-3, magnesium collagen, curcumin. This combination dramatically accelerates recovery. 19. Realistic expectations. What patients should know. Frozen shoulder always improves. It is not a permanent disease. Pain improves first. Stiffness improves next. Movement returns slowly but steadily. Exercises must be gentle and consistent, not forceful. Energy medicine accelerates every stage. Early treatment shortens suffering drastically. Untreated cases take the longest to heal. Patients often regain 70 to 80% movement within months, 90 to 100% movement gradually, full daily activity, return, sleep restoration, strength recovery. 20. A gentle but strong message for diabetic and thyroid patients. Frozen shoulder affects diabetics up to 5 to 10 times more. Why? Because high sugar triggers. Collagen glycation, stiff capsule, reduced circulation, inflammation, delayed healing. Hypothyroid patients have slow tissue metabolism, increased water retention, increased inflammation. For them, energy medicine is extremely beneficial because it boosts microcirculation, mitochondrial function, tissue oxygenation, capsule mobility. 21. What makes the clinic's approach special? In this clinic, the treatment philosophy is treat the inflammation, treat the stiffness, treat the pain, treat the posture, treat the mind, treat the energy, treat the entire person. You don't target one layer, you treat all layers simultaneously. Physical, neurological, biochemical, emotional, energy system. This is why the patients recover even when others have failed. Conclusion. My dear friends, shoulder pain may weaken your arm, but it does not weaken your spirit. Frozen shoulder may limit your movement, but it does not limit your destiny. Yes, this condition is painful. Yes, it is frustrating. Yes, it steals months of your life. Yes, it makes daily tasks difficult. But today, you have more hope than ever. Because now we know your shoulder can heal, your movement can return, your pain can reduce dramatically, your stiffness can melt, your capsule can open, your life can go back to normal. And modern science has gifted us tools that accelerate this process. EMTT for rapid deep pain and inflammation relief. TCAR for softening the capsule. Terahertz for hydration and cellular activation. Infrared for soothing and repair. Exercises tailored to your recovery phase. Mitochondria supportive lifestyle. Anti-inflammatory diet. Nervous system calming techniques. When you combine these tools, healing does not take years. It takes weeks or months, depending on how early you start. Your shoulder is not frozen forever. Your life is not frozen forever. You have inside you a healing intelligence that is stronger than pain, stronger than stiffness, stronger than inflammation. With the right support, that intelligence awakens. And when it awakens, movement returns, strength returns, freedom returns, and life becomes yours again. This is the truth of modern medicine. This is the promise of energy-based science. This is the destiny of your healing journey. Your shoulder is waiting to heal, and it will. Thank you. Founder, Holistic Wellness. Foundation. Imphal healing beyond boundaries.